Bismillah ar-Rahman ar-Rahim. Our respected members and a very warm welcome. First of all, I will go with services rendered for vulnerable group in Balochistan through Social Welfare Department. Although the government of Balochistan, through its health department, is delivering health services across the province, from tertiary healthcare hospitals to district health hospitals, to BHU and to the civil dispensaries at the community level. However, government of Balochistan has established an endowment fund named Balochistan Awami Endowment Fund, and an amount of Rs 7.5 billion has been invested as seed money to generate sustainable proceeds for providing free treatment to poor and destitute patients. Under this initiative, free medical services are offered for 7 chronic diseases that include liver and kidney transplant, thalassemia, cancer, burn cases, heart diseases, and cochlear implant through different empaneled hospitals across the country. Since 2019, more than 5,000 lives have been saved through a life-saving transplant and other specialized treatment, with approximately 5 million spent on ensuring quality healthcare services for people of the province. And those include 318 liver transplant, 234 kidney transplant, and 3,500 cancer cases. Along with for persons with disabilities. For the welfare of persons with disabilities, the government of Balochistan has launched an excellent initiative titled COMAC, a local word meant support. Under this program, the government provides assistance in 6 thematic areas that include education, skill development, marriage grant, assistive devices, monthly stipend, and microloan, aimed at promoting inclusion, self-reliance, and the socio-economic empowerment of people with disabilities. One significant yet often neglected component for persons with disabilities is their special education, which includes dedicated institutions for children with physical disabilities, hearing and speech impairment, visual impairment, and mentally retarded schools. To address this critical need, 4 special education complexes have so far been established, while 3 additional complexes are currently under construction to further expand access to exclusive and specialized education in Balochistan. There is one orthotic, prosthetic, and physiotherapy center established in the province, wherein modern prosthetic devices and orthotic appliances are manufactured to enhance mobility and promote independence among persons with disabilities. It is the only institution in the province dedicated to the production of artificial limbs. Special support program. Keeping in view the prevailing extreme poverty, the government of Balochistan is providing financial assistance to deserving students, patients, disaster-affected individuals, and sports persons. Support for collective marriages is also extended under social support program. Rehabilitation of drug addict persons. Due to porous borders and other contributing factors, a significant number of people in the province have been affected by the menace of drug addict. It is estimated that more than 0.5 million individuals are suffering from substance abuse. Recognizing the gravity of the situation, the government of Balochistan has taken concrete steps to address these growing challenges. To detoxify and rehabilitate affected individuals, the government has initiated the establishment of 14 treatment and rehabilitation complexes, out of which 3 are currently functional. Furthermore, to specifically address the rising issue of female drug addict, a model drug rehabilitation complex for women is under construction. And as a special initiative of the Honorable Chief Minister, the Quetta Free Drug Campaign was launched in April 2025, and since its inception, approximately 3,005 addicted individuals have been treated and rehabilitated under this campaign. a welfare home for beggars. Begging has become a significant social nuisance and has increased rapidly in recent years. To address this issue, the government of Balochistan, through Social Welfare Department, has established a welfare home for beggars in Quetta. The aim is to rehabilitate them and provide skill training to help them become productive and respectable citizens of the province. Additionally, another model welfare home for women and children beggars is currently under construction. Illiteracy remains the foremost barrier to the development and economic prosperity of the country. In Balochistan, out of 5.1 million school-going children, 3.4 million are out of school. Out of total 5.1 million children, 3.4 million are out of school. Alarmingly, 1.8 million of these children aged bracket 10 to 16 have missed their first opportunity to attend school. To address this challenge, the government of Balochistan has established the Directorate of Literacy and Non-Formal Education to provide these children with an opportunity to become literate through non-formal education. To this end, the Directorate has established 480 alternative learning pathways and 150 adult literacy centers across the province. The government of Balochistan is committed to provide welfare services to senior citizens. For this purpose, 2 senior citizen complexes are currently in the process of being operationalized. To alleviate poverty, the Social Welfare Department has implemented asset distribution schemes to create self-employment and livelihood opportunities. In this regard, over 7,000 assets and toolkits were distributed among poor individuals and persons with disabilities during 2025. For the welfare of persecuted and oppressed women in the province, the government of Balochistan has established safe homes, also known as Darul Aman, where residents are provided with shelter and technical skill for empowerment. Currently, 2 safe homes are operational. And to support at-risk and abused children, the Social Welfare Department, with the assistance of UNICEF, has established 11 child protection centers across the province. And for the welfare of prisoners, the government of Balochistan has established prisoner welfare centers at 2 major prisons, providing socio-psycho support, skill development, and literacy. And drug control, Quetta drug control plan is successfully implemented, as stated earlier. Critical cases and proposed strategic interventions. As I highlighted in the previous slides, the government of Balochistan has taken numerous steps to improve the economic, health, and educational well-being of its vulnerable group. However, the maximum benefit can be achieved through the establishment of model institutes, complexes, and centers, as the existing facilities do not fulfill their intent purpose. The model institute or complex should include skill development components, digitized data management, comprehensive in-house facilities, transport supports, specialized technical staff, and purpose-built infrastructure. Currently, the majority of the centers and complexes operate in rented or non-purpose-built buildings, which limits their effectiveness. And respected developer partners are therefore requested to collaborate and strengthen these institutions and address the existing gap. There is a dire need for centralized social protection data registry at the Directorate level of social welfare to maintain an updated status of all vulnerable groups, including beggars, drug addicts, persecuted women, abused children, transgender individuals, senior citizens, orphan children, out-of-school children, illiterate persons, prisoners, widows, and others. The menace of illiteracy is rampant in Balochistan, where out of 5.1 million school-age children, 3.4 million remain out of school. And 1.8 million of these children fall within the mandate of non-formal education, being aged 10 to 16. As they have already missed first chance of going to school, The Honorable Chief Minister of Balochistan has already inaugurated the Zero Out of School Children campaign. However, till date, the government of Balochistan, together with its donor partner, is providing formal education to only 65,000 children out of total 1.8 million. And the Directorate of Literacy and Non-Formal Education has established only 480 alternative learning pathway centers for children and 150 adult literacy centers across the province. It is worth noting that the curriculum, textbooks, tutor guide, training module, customized skill trades, and training of trainers required for NFE have already been developed with the support of JICA, and the government of Balochistan is grateful for their wholehearted assistance in establishing the necessary structure for ALP and ALC. Given the scale of the challenge, development partners are urged to consider non-formal education as a viable and cost-effective solution for addressing the out-of-school children issue, as it requires minimal infrastructure and no long liabilities. In this regard, at least 20,000 new NFE centers are urgently required to integrate 500,000 out-of-school children into the education system. Improving adult literacy is a key driver of economic development. To support this, the curriculum, textbooks, and skill trade program are already in place. Currently, only 150 adult literacy centers provide literacy to only 5,000 literate adults. However, to effectively address the widespread literacy in the province, at least 1,500 ASC centers are required. Regarding the operationalization and upgradation of already existing institutes, the province currently has 14 drug rehabilitation centers, 1 welfare home for beggars, 10 child protection units, 2 senior citizen complexes, 2 safe houses. All of these facilities require significant upgradation to enhance their effectiveness, and additionally, there is a dire need to increase the number of these centers, targeting at least 1 facility at the divisional level to ensure broader coverage and accessibility to vulnerable population. The government of Balochistan has established the Balochistan Awami Endowment Fund with a seed capital of Rs 7.5 billion, Comac Fund, a person with disability endowment fund with Rs 3 billion, and a beggar endowment fund with Rs 50 million. The proceeds from these funds are utilized to provide treatment for patients with chronic diseases and support the welfare of persons with disabilities and beggars, as outlined in the previous slides. While these endowment funds have significant impact for their targeted beneficiaries, however, the coverage is insufficient given the large beneficiary base. For example, during the last Balochistan Awami Endowment Fund Board meeting, 1,090 cases of chronic disease were presented with cost estimates of 2.2 billion, whereas the annual proceeds of BEF amount to only Rs 1 billion, leaving a gap of more than double the available resource to meet all needs. Development partners are encouraged to collaborate and contribute, including funding for specific disease. A similar challenge exists with the Comac Fund, which supports people with disability in 6 key areas. According to WHO assessment, 15% of the population experiences some sort of disability. However, the 2023 census reports 312,000 PWDs in the province, likely an underestimation due to social stigma, as people are reluctant to show their disabilities. The monthly proceed for the Comac Fund is just 27 million, which is insufficient to meet the need of all people with disabilities. Development partners may collaborate in terms of any of the program, including education, skill development, monthly stipends, accessibility devices, marriage support, or livelihood initiatives meant exclusively for people with disabilities. Similarly, the Beggar Endowment Fund plays a crucial role, especially in Quetta. However, the monthly proceeds are negligible, limiting the fund's effectiveness to make Quetta a beggar-free city, the seed money of this fund needs to be enhanced to a meaningful and sustainable level. One last slide. Establishment of critical institutions, those are not available in the province, are orphanage or sweet homes, autism resource centers, psychosocial support center, independent living centers. All are currently unavailable in the province despite their critical importance for the well-being of vulnerable group. Similarly, livelihood and self-employment support through training opportunities and asset distribution. In view of the 72% multidimensional poverty in the province, providing tangible assets such as sewing and embroidery machines, technical toolkits for plumbing, electrical work, mobile repair, machinery, carpet, laptops, etc., so that to enable ultra-poor individuals to pursue self-employment and sustainable livelihood. There is a dire need of construction of workshops for imparting training of the vulnerable groups, including destitute persons and those who are illiterate and lack any skill in their hand. These workshops may be established at the institutes where vulnerable groups are rehabilitated. Thank you.